Hello, it's Jane. It's been quite a day, an eventful day. Um, so yesterday they took the outer bandage off, and um, it felt really good to have. Actually, no, it didn't. It felt really exposing to have it off, didn't I? I said that, didn't I? Yeah, yeah. I mean, in some aspect, later on, it felt a little bit I felt, I don't know, freer to have it off, but at the same time, it felt really exposed. Um, but by the evening, um, the stent was trying to push out, and it was pulling on those three stitches, pushing on those three stitches. And by 11 p.m., between that pain and um, the constant headache I have from these really terrible pillows. They're like sandbags. They're so hard. Um, Between the constant headache and that pain, I started to get a migraine. So I broke down and asked for tramadol. I gotta look up what's in tramadol because I keep getting mixed. I hate it when people use product names for drugs. Like, why would anybody use a product name for a drug? Use the compound name. It, it, it like different companies can have different names for the same compound. Why do that? Use the compound name. Anyways, it's my beef with pharmacology. Um, Anyways, yeah. So I broke down and asked for some tramadol because it was just both pains were so bad. I knew I was going to get a migraine. So they gave me tramadol. It was fine. That got me through the night. And in the morning, I was in so much pain down there because of the pulling of the stitches that right after breakfast, I went straight to the nursing station. I said, can we get this out now? And she said, yeah, sure, no problem. So we went and she took the stent out right away. And it hurt like hell down there. Not inside, but just where the stitches were. Just that whole area just felt so raw and painful. That was the most painful part of this entire experience was last night and this morning. The pulling of the stitches, or the, the pushing of the stent, which was pulling on the stitches. You probably can't see over there. So the stent's pushing out and the three stitches, and it's, yeah. Anyways. Oh my God. That was a lot of pain. But once it was out, it was out, and over the course of the day, the rawness and everything has been steadily decreasing, and it's feeling pretty good now. So I think by tomorrow morning, I think a lot of that pain will be gone. So I waited a while with some ice because I needed ice down there. Oh my God, did I need ice down there? Maybe an hour, I think I waited with ice on it. And then the nurse came and she showed me how to dilate, which was interesting. No pain. Well, okay. The first dilation, there was a little bit of pain along the suture line up right at the top of the vaginal cavity. Just like I'm talking a 1.5 out of 10. Like it was just barely noticeable pain, the suture line, and nothing else. And no discomfort with it being in there. And I did the 3 for 5 minutes and then the 4 for 25 minutes. No problem. Totally comfortable. Totally fine. Now, going in, the dilator, it feels okay. Yeah, I don't really have a problem with the way it feels going in. Coming out, however, it is the grossest feeling. I won't say in my life, but it's up there for gross feelings, gross bodily feelings. It's pretty high up there. And all day I've been trying to think of what an analog would be to that, what that feels like coming out. And this isn't going to be meaningful to most people. So it's not a very good analogy, but it's literally the only analog I could think of. But if you've ever had like a doctor go up your nose to do stuff, anything right up in the nasal cavity, if they like pull out a piece of gauze or something that goes up there for whatever reason, there's a kind of really gross feeling as it comes out. Not in the nose itself. Yes, I'm sticking my finger in my nose. Not in the nose, but up in the nasal cavity up here. Um, if a doctor's ever pulled anything out of there that was sort of soft and squishy, and the dilators are not soft or squishy, they're hard plastic, but the experience is soft and squishy. That's the closest analog that I can think of. I mean, maybe cis women would know an analog, but then how would a cis woman know what it's like to dilate a trans woman's vaginal cavity? You know what I mean? But any associate, because the nurse will say like, oh yeah, it's like, if you like make a big poo or something like that. No, it has no similarity to anything that goes into or out of an anus. Nothing. No similarities whatsoever. It is the grossest feeling when it comes out. Oh, I'll get used to it, right? The reason why it's gross is because it's sending signals to my brain that are absolutely fundamentally new, and my brain is going, wow, I don't know what that is. I don't know what that is. So once I get used to it, I'm sure it'll be fine. But right now, because I've only had the 3 dilations today, yeah, it's really, really gross feeling coming out. But no pain, no discomfort. The dilating is going fine. There's a lot of blood in the discharge, but that's absolutely normal. There isn't more blood than usual, and yeah, I mean, it's not, yeah, there isn't enough blood coming out to make me question, you know, it at all. Like it looks like a perfectly reasonable amount of blood given all of the suture lines up there and the fact that everything's being stretched every few hours by this. I should show my video tomorrow. I'll show the dilators. I don't want to get up and get them because it would the camera and everything. It's a pain in the ass. But tomorrow I'll show the dilators. Yeah, it's all right. It's good. I'm quite happy that the dilating is easy, because it's for some people it's not easy, and yeah, I can feel quite lucky that it's going fine. Very raw on the outside still, better than this morning, but still, everything is tender and raw, and obviously because there's suture lines and everything, and it might get tender and raw inside too once things start to innervate inside there. I don't know. I mean, by then I think the suture lines should all be sealed up. Like they should be all starting to scar up by the time I start innervating inside there. Bruising is a bit more than it was yesterday, but only a bit more, so I don't really think it's going to get much worse. The blood tube is definitely leaking a lot less, so I'm going to need another Band-Aid for tomorrow, maybe for the next day. But yeah, that's definitely closing up. Obviously dilating. I got a mirror. Again, you can't see my hand. There's a mirror that I can watch what I'm doing, so I'm getting a much better look at things down there. And it's tough to look at because it is a car crash down there, but it's, yeah, I'm getting used to it. I just want it healed. Everything will be so much better when it's all healed. And And yeah, I've just been battling stupid. I had a really bad migraine today. Like last night, it was a headache and the pain, and I took the tramadol and went to bed, and it staved off the migraine. But this morning, I had a full blown migraine. Now I took tramadol, and I wasn't feeling the pain, but I was getting all the side effects of the migraine. You know, the dizziness and the spaciness and the light sensitivity and sound sensitivity and all that sort of crap. And I'm just, my brain is exhausted now. Absolutely exhausted. So it's been a big day. It's been a big day. And because this is a surgical site, there's all sorts of, precautions you've got to take with the dilators, with cleaning them properly and cleaning you wash your hands with soap and then you use um, a foaming hand sanitizer on your hands as well, and then you have to douche afterwards to get the lubricant out, and you douche with saline, so 0.7% salt in the water. I think that's what it is, something like that. I think it's 0.7. Yeah, so there's like steps, there's steps you have to take, but it's not complicated. And you can easily get everything done in an hour. So basically, when it's time to start, I'll get the dilators out of the holder it's in, and I'll show that tomorrow. I get the dilators out. You wash them with antibacterial soap, and then you have a sterile tray and wet wipes and gauze and the hand sanitizer and the lube, and you put down a non-permeable sheet, like it's I don't know what they're called, but it's like plastic on one side and then the cottony material on the other side. You put that down because that's what you sit on. You set up your mirror so that you're aligned properly. You kind of bring the bed up so that you're at the right angle, so it's all easy. Then you have another, the dental bibs that they use dental bibs, yeah. Basically, one of those. You just keep one of those down beside you, because when you finish dilating with each of the dilators, you need to put it down somewhere, because they're like super gross when they come out. And then you can get started. So you start with the 3, and you put lots of lube on the end, and you go down at a 45-degree angle for a little bit, and then you turn and you go in straight until you get right to the end of the vaginal cavity, and you feel it, when you're at the end, and you hold that there for 5 minutes, and then you take it out and go, because it feels so gross to take it out. And then you get your number 4, and you put just a small dollop on it of the lube, and then it goes in, and you hold it for 25 minutes, and then it comes out, and it's extra gross. And you put that down, and then I don't wash them right away, because I'm sharing a bathroom with somebody else, so I like to get into the bathroom and out as fast as possible. Oh, did I? Yeah, I did. Sorry, I thought it wasn't sure if I'd asked them to clean the bathroom, but yes, I did. So I don't wash them right away. I wash them after, because I want to get into the bathroom and out, so that they can come and clean the tub, because they got to clean the tub after every patient, because we're all, bleeding messes. So, we've got to prevent infections. So I have a sitz bath for 10 minutes, and quite a lot of blood ends up in the water. And then I put the juice bulb, the juice, the douche bulb up and squeeze all the water out of it, and it washes quite a lot of bloody material out. It's challenging for somebody with medical phobia like me. And then you just rinse everything off gently and dry yourself, pat dry down there. And then I come back into the room, and then I clean the dilators and with the antibacterial soap, and I put them back in the case, the bag, or the holder, and then I wash the douche bulb, and with the soap as well to clean it out, and then I lay down for at least an hour to leave everything wide open. That's uncomfortable. Leave everything wide open to let it air dry. You spend a lot of time naked from the waist down here. After everything is off, you spend a lot of your time naked from the waist half down. From the waist, from the waist down. So hopefully the camera is not showing any of that, because I'm making this while I'm air drying. So yeah, you can basically do all of the stuff in an hour, and then you gotta air dry for an hour, which here, you just gotta lay here and do stuff, or lay here and, keep yourself occupied. At home, I'll be able to code, right? Once I'm done and I'm laying down and air dry, then I can start coding, and whatever other work I need to do. So yeah, so basically it's 4 hours a day of the actual hands-on work you need to do, and then another 4 hours a day of air drying, and then that's for the first month. And then for the second and third month, it's 3 times a day. And then after that, it goes down to 2 times a day. No, it goes down to 1 time a day. Yeah. After 3 months? No. After 3 months, it goes down to 2 times a day for 3 months. And then at the 6-month mark, it goes down to once a day for 6 months. And then at the end of the first year, you've basically healed as much as you're going to heal. So at that point, you only need to dilate once a week. And sex doesn't count. Sex does not count as dilating. So you got to do it once a week, regardless. So yeah, I'm very happy that it's going well. I feel so vulnerable now, physically and emotionally and mentally. I just feel so incredibly vulnerable now, because it's still healing, right? Once it's finished healing, and it's a routine, and it's my new life. It's the old life, but it's new too, in a certain way. I'm sure I won't feel as vulnerable as I do now, but yeah, my God, I feel so vulnerable. Ever since the bandage was taken off, I have felt so exposed and vulnerable down there because it's really tender. The inside is fine. Inside, I don't feel any pain whatsoever, but all the outside is really, really tender because, well, it's all suture lines and stuff, right? Oh, they left the catheter in because there was a lot of blood around their urethra. Um, when they took when they took the um, stent out. So they left the catheter in for one more day. So tomorrow morning they'll take the catheter out, and I'll be so glad when the catheter comes out. My God, I'm tired of this. I hate this. Ugh, I feel for people who have to have caths permanently. You know. Oh my God, it's terrible. It is terrible. Yeah, so then the blood tube is decreasing. I said that already, I think. Yeah. Yeah, I wish I didn't have these stupid headaches and migraines, and wish I didn't have anything going on up here, because if I didn't have anything going on up here, it'd be so much easier to focus on what's going on down there. But at the same time, I guess the headaches are kind of distracting. So maybe the medical freakiness of what's going on down there is less impactful because of the headaches. I don't know. There's got to be some karmic reason why I'm getting these fucking headaches. Oh. Yeah. So the sensation of it being in there, the 4 actually, I think the 4 actually feels better than the 3, because the 4 pushes out sideways more because it's larger. And I think by pushing out sideways more, there's less sense of pokiness at the end, whereas the 3 is narrower and it feels pokier at the end. Yeah, I think the 3 is less comfortable than the 4, even though the 4 is physically bigger, because there's no pain or anything. Like, it's not, there's plenty of room for the 4 in there. And yeah, I think it actually feels better. But you have to put the 3 in first, just to kind of get everything used to there being something in there before you bring out the big guns. And again, yeah, I'll show you tomorrow what they look like. Is there anything else? So tomorrow I will be getting the catheter out. Tomorrow I will be dilating 4 times. There is a meeting for some patients on going home instructions. There was a meeting today that I could have joined, but my head was bothering me too much. But I could hear in the hallway, and it ran for about 45 minutes. So I don't know what was discussed. I couldn't hear that well, but yeah, around 6 p.m. there will be a meeting for outgoing patients. And that's tomorrow. And then Wednesday I get to go home. Oh my God, I so want to go home. I hate being here. They're nice people, lovely people. They do a fantastic job, but I want to be at home. I want to be in my bed with my pillows, my soft pillows. Yeah. I'll probably have more to say about the experience of dilating tomorrow, because I'm still trying to wrap my head around the experience. But tomorrow I'll do the video earlier in the day, because I just wanted to do this one later so that I did all three, so that at least I could say, you know, I did three in a row and they all felt fine and they all felt the same, which they did all feel fine and they did all feel the same. So yeah, I guess I'm gonna leave it there because my head is hurting and I would like to cover my eyes because the light is bothering me. So I'll talk to you tomorrow, and I love y'all, and have a good night.